Hello, my name is Brandon Hickey, and I am with BMI 598, the telemedicine course provided by Arizona State University. And for my term project, I went with an all-in-one telehealth platform that helps with peer-to-peer collaboration between healthcare professionals, and it's called 1Provider. Sort of the overview of what 1Provider is the first and what really the core component is peer-to-peer collaboration. So what this means is two things. The first is it could be while the provider is actually seeing the patients, and if they needed an expert consultation while seeing the patient, they could collaborate with subject matter experts in the field that they're looking for, as well as it could be collaboration off hours, when they're not seeing the patient, and this could be for visits that they had during the day, as well as for visits coming up for the week that they'd like to discuss with someone with maybe a little bit more expertise in that visit. The second piece is we really want these clinicians and other healthcare professionals to be able to access our platform anytime, anywhere. So what we came up with was a cloud-based solution that can be accessible from all devices and all operating systems. The third piece, and something that I think is a really selling point for 1Provider, is real-time clinical decision support. So this would be while they're actually seeing the patient, and we can actually bring up data like vitals and labs that would be relevant for that visit, and also some recommendations at point of care. So things like starting a medication if we found in their clinical record that they qualified for a statin therapy or anticoagulation therapy, things like that. For the fourth piece is interoperability. So care teams being able to see patients outside of their normal scope and being able to step up and work within their own care teams and see notes about meetings that are coming up or other visits that they can really help with. And the fifth piece is just to be HIPAA compliant and to make sure that no matter what state and that the provider is practicing in, that they meet the legal requirements, and that we are ensuring that our platform has the patient's privacy at the utmost importance. So our goals and objectives, so we talked a little bit about peer-to-peer collaboration. Well, we're going to do this through video chat and conferencing, and that is what we're going to leverage, and I'll talk about later with eVisit, technology platform for doing video conferencing. The second piece is advanced clinical decision support. So for this goal, what we really want to do is improve the patient to provider experience while they're actually seen during the visit. So we're going to do that through CDS rules and other ways that the provider has all the information they need to make the best decision with the patient and a better outcome, hopefully. The third and last piece is population health and research. So all of this data that we're going to be retrieving in real time is going to be extremely beneficial, especially for primary care clinics, family medicine clinics. All this data can really be used for population health research and population analytics. You know, what patients are coming into the clinic at what times, and what are they being seen for, and how could they optimize, and they can really use our analytic tools to provide them some more clarity on those issues. Our revenue model, so we're hoping that this can really benefit three areas of healthcare. One would be the healthcare professionals themselves, so they're able to better optimize their own workflows. They're not going to have to go through the EMR and search for all this data. It's just going to be brought to them at point of care in real time. And they'll also have access to subject matter experts in their field, which will be extremely beneficial when they're seeing a visit that they might just not have the expertise fully in. And then it also provides a learning tool for them as well. So they're learning during these visits what should be the best plan or treatment for that patient. The third piece is hospitals and clinics. So since we're trying to optimize provider workflows, that means that we're also going to be bringing in revenue for these hospitals and clinics by saving time and money, and also allowing patients to not have to necessarily come in always for a visit if it's unnecessary and can be done through telehealth. And the third piece is just benefits for the patients. If we're able to better monitor their own data, their labs, their vitals, as well as be able to generate recommendations that the clinician may have missed from the EMR, we're really providing more safety that way, and hopefully some better outcomes for the patients. So for the technology, I highlighted it earlier, but what we really want to do is integrate with eVisit. We did some research on what tools are available today, and eVisit really provides a great platform for telehealth conferencing between provider to patient, as well as provider to provider. And what we want to do is we want to layer on top of that our clinical rules engine. And this clinical rules engine will do things like generate recommendations. It's also completely customizable. So providers can work with the IT team to generate these rules that they find will be beneficial for their practice. So if it's finding that the patient does have atrial fibrillation and no bleeding disorder, that they probably should be on an anticoagulant at that time. So we could generate that rule in real time at point of care. And the last piece, and what it's really all sitting on top of, is our telehealth platform, our analytics platform, that we're going to be able to integrate with many EHR systems, and within that, we'll be able to collect the data that we'll need, that we can really create a great interface for providers, for research teams, for IT to really leverage and carry out their research effectively. So here's what eVisit looks like today. And you can see that it's a very, very simple UI, and it's very clean. So it'll allow pretty seamless integration for providers. There's not a lot of overhead of learning. And what we want to do is layer on top our CDS rules. And here's a simple representation. It would just be a module that would sit on top. That would show things like the patient name, vitals, labs, any problems they have, and any recommendations that we have found from the rules that were generated by the IT team or the subject matter experts. And from there, we would just have our population health analytics that's just demonstrating here that the provider really anywhere on the go can see the tools or see the analytics for a specific patient, which is great for individualized medicine and better outcomes for the patient. Really quickly, I want to just touch on what the legal and licensure and policies that we would need in place for a product like this. I mean, the first key thing is patient privacy. So we want to make sure that us as a company are protected, that we're not that we're keeping our IT security, our architecture there at the highest standard always. And then also that really comes down to the provider's duty of care as well. And for what, they can't be negligent just because they're on a telehealth conference. They need to make sure that the patient's safety and the patient's PHI information is protected at all times. What we thought would be a great tool to incorporate is a licensure approval process. So we know that there are certain state regulations, national regulations that they need, certain licensures if they need to practice across states. So what we would do is actually create a platform within our own that would allow them to go through an approval process and start with simple in-state and then progressively move towards making sure that they can practice telehealth medicine across the country. And we could do periodic status checks, which would be very helpful. So in case they need to renew their license, we can prompt them that they need to reapply for their licensure. And the third piece is just procedures and protocols. Hospitals and clinics already have these in place, but what we could do is create our own templates, things that they could leverage that would really help their practice understand what are the legal implications for using our platform, for using eVisit, and ensuring that when they're actually meeting with the patient, they have that consent that's necessary to carry out the telehealth conference. All those things we could really build into our platform so that the providers and the clinics are not having to think about this every time they set up a new call or do research on information from that call. So thank you. I'll take time for any questions in the discussion board, and that is 1Provider. Thank you.